Hello and welcome. If you're running a healthcare clinic in the US today, you already know the pressure is on. We're going to dive right into the operational challenges that are squeezing practices and then explore a really powerful solution that's changing the game for how modern clinics can thrive. So, let me just ask you this straight up. Does it ever feel like administrative friction? That constant, never ending grind of paperwork, phone calls, and data entry is what's really running your practice? If you're nodding your head right now, trust me, you are absolutely not alone. You see, we're in what you could call a genuine clinic operations crisis. The US healthcare system as a whole is under an incredible amount of pressure. And these aren't just temporary problems. This is, for better or worse, the new reality for clinic owners and managers just like you. Let's put a hard number to this crisis because it's pretty staggering. 138,000. That's the number of nurses who have left the workforce in just the last couple of years. Think about that. This isn't just a staffing shortage. It's a massive talent vacuum, and it puts an incredible strain on the dedicated staff you have left. And at the exact same time you're struggling to find people, the cost of labor is just soaring. Labor costs shot up by 5.6% recently, and that puts a direct, painful squeeze on your margins, making it harder than ever to stay financially healthy, let alone profitable. This quote here really hits the nail on the head. We are at a pivotal inflection point. These aren't just small hurdles, this is a full-on collision of major forces. And what that really means is that the old way of running a clinic, it's just not financially sustainable anymore. So how do all these big systemic problems actually show up in your clinic every single day? Well, they turn into this soul-crushing administrative drain on your team. And believe me, this is way more than just paperwork. It's like trying to walk through quicksand. And this really says it all, doesn't it? This constant whirlwind of scheduling, checking insurance, fighting for prior auths, chasing down claims, endless data entry. Any one of these tasks is manageable on its own. But when you put them all together, they create this relentless cycle of overload that just eats up your most valuable resource, your people's time and energy. And here's the human cost of all that. It leads directly to burnout, especially for physicians. And it's created this phenomenon called pajama time. I'm not kidding. That's the 2 or 3 extra hours doctors are spending at home after a full day with patients just to catch up on charting. It is a loud, clear, and painful symptom of a system that's just not working efficiently. Okay, but what if there was a way to just dismantle that administrative burden, to get out of the quicksand? We're going to pivot now from the problem to a modern strategic solution that's designed to help your practice reclaim its time and, most importantly, its focus on actually caring for patients. And that solution is all about strategically bringing on trained medical virtual assistants, or MVAs, from our team here at Virtual Next Gen Solutions. Now, this isn't just about outsourcing a few tasks. No, this is about fundamentally redesigning your clinic's workflow for this new era in healthcare. So what exactly is a medical virtual assistant? Well, think of an MVA as a highly trained, fully HIPAA-compliant professional who acts as a remote extension of your own clinical team. They are specialists who handle the very administrative and operational tasks that are bogging your practice down right now. And this chart makes the connection crystal clear. When an MVA handles your appointment scheduling, you immediately see fewer no-shows and a much smoother workflow. When they take on insurance verification, you get fewer claim denials and faster appointments. It's simple. They tackle those awful prior authorizations, which means way less frustration for your staff and better revenue. And by managing EHR documentation, they give your physicians their time back, directly fighting that pajama time burnout. And here's a really crucial piece of the puzzle: technology. Our MBAs are already experts in the major platforms you're probably using every single day. Whether you run on Epic, Athena Health, NextGen, or any of these others, they can plug right into your existing workflow from day one. There's no major learning curve, no downtime. Okay, this all sounds great in theory, right? But what about the real world? Let's look at some actual evidence of transformation. Let's see the real results this is delivering for real clinics all across the country. Let's take a clinic down in Texas. Before, their scheduling was a mess. They were constantly missing insurance verifications, which led to huge payment delays. It was chaos. After bringing in an MVA, their entire workflow was streamlined. Scheduling became organized and proactive, and their overall operational efficiency just went through the roof. Or how about this multi-specialty clinic in Florida? Their in-house staff was completely swamped, totally overwhelmed. This was causing burnout and a lot of costly scheduling errors. After getting MVA support, their administrative burden dropped by over 40%. The result? a huge boost in staff morale, and way more accurate patient scheduling. And one more, a family practice out in California that felt like they were drowning in complex billing and high denial rates. By bringing on an MVA who focused specifically on their revenue cycle, they saw their clean claim rate jump up, their follow-ups became systematic, and their entire financial engine got a major tune-up. So what does this all mean for you and your practice? It means you should reframe this. This isn't just about making another hire. This is a strategic decision to future-proof your practice. It's about building real, durable operational resilience for the long haul. The biggest takeaway here is pretty clear. Given all the pressures we just talked about, remote operational support isn't just an alternative anymore. It's quickly becoming the new standard for running an efficient, a scalable, and a truly resilient clinic. It really is the future. And the best part is, getting started is really straightforward. The path begins with just visiting our website to learn a little more. From there, you can schedule a free consultation so we can understand your specific needs. And that can lead directly to totally transforming your clinic's operations. Look, the bottom line is this. The pressures on your clinic are very real, but they are not unbeatable. By strategically integrating medical virtual assistants, you can solve that administrative drain, empower your staff, and build a more profitable, more resilient practice. To find out exactly how, I really encourage you to reach out and just start the conversation. The only question left is, are you ready to get back to focusing on your patients instead of all that paperwork? Thanks so much for your time.